It is a true honor to announce the William E. Ladd Medal. The Ladd Medal is the highest award given by the American Academy of Pediatrics. It is named in honor of William E. Ladd, the father of pediatric surgery in North America, and the first surgeon-in-chief at Boston Children's Hospital from 1928 to 1946. Dr. Ladd developed the first training program in pediatric surgery in North America and advanced the care of surgical patients with the development of new technologies for treating surgical illness. This medal recognizes the pediatric surgeon who has made significant contributions to our field and to the care of infants and children. The award was initiated in 1954 and has subsequently been granted to many of the surgical giants of our specialty in recognition of their seminal contributions. I am so pleased to announce this year's Ladd Medal recipient, Dr. Thomas Crummell. To introduce Dr. Crummell is Dr. Michael Longacher. Mike is Tom's longest standing friend and colleague in surgery. They met at UCSF in 1985 when Tom was a postdoc in Mike Harrison's lab and Mike was the junior resident rotating on the pediatric surgery service. 20 years ago, Tom recruited Mike to Stanford to build the surgical research programs, and the rest is history. Dr. Longacher.
Thank you, Dr. Bessner. It is my pleasure to introduce this year's recipient of the William E. Ladd Medal from the American Academy of Pediatrics to Dr. Thomas M Crumble. Dr. Crumble is richly deserving of this prestigious honor. He has impacted the lives of countless children as a surgeon, scientist, and innovator. Let's start with origins. Dr. Crumble is the oldest of 4 children born to Jim and Helen Crummell in Racine, Wisconsin, and you see Tom on the left here with his siblings. Here he is in a wintertime family outing, again on the left with his brothers and sisters. Dr. Crummell attended St. Catherine's High School, where he was a leader at a young age. He was student council president, captain of the golf team, and valedictorian of his class. Dr. Crummell then attended the University of Wisconsin Parkside for college and worked 2 jobs during these 4 years. He saved enough money to pay for his first 2 years of medical school at the Medical College of Wisconsin. It's no surprise that Tom received the Millman Award as the outstanding graduate in his medical school class, and notably, this award was voted on by his classmates. Productive collisions. Dr. Crummell became interested in surgery based on his experience with Dr. Larry Bonchek, a cardiac surgeon, and Dr. Myron Kaufman, a transplant surgeon. Dr. Kaufman trained at the Medical College of Virginia, and Dr. Crummell, after hearing about Dr. Kaufman's training experience, matched at Medical College of Virginia. It was there that Dr. Crummell met Dr. Arnold Salzburg, who became a critically important mentor in Dr. Crummell's career. It is important for many reasons, one of which is the Arnold Salzburg Mentorship Award given each year by the Society. Dr. Crummell sought out extremely talented mentors and believed these productive collisions were critically important in his career. One of the seminal moments in Dr. Crummell's career came during his junior resident years when Dr. Bob Bartlett, a past winner of this award, was a visiting professor and delivered a talk on ECMO. Dr. Salzburg nudged Dr. Crummell to go and speak to Dr. Bartlett because they had just performed a state-of-the-art CDH repair on 2 babies who subsequently died from pulmonary hypertension. Dr. Bartlett said after meeting Tom, "Sure, come out and visit me in California and I'll be happy to show you the procedure." Dr. Crummell got a phone call 6 weeks later when he was now a research fellow working with Dr. Salzburg. Dr. Bartlett asked Dr. Crummell if he could come out immediately because he was going to put 2 children on ECMO. Dr. Crummell booked a flight and was picked up by Dr. Bartlett himself. Dr. Crummell spent the next 10 days on a cot living in the Children's Hospital of Orange County, reading a different book every day on a topic important to ECMO that was given to him by Dr. Bartlett. Amazingly, Dr. Crummell, without a California license, scrubbed with Dr. Bartlett as both babies came off ECMO. He even got to ligate the ductus in one of the children. Upon returning to Richmond, Dr. Crummell, as a resident, working with 2 dog lab technicians and a neonatology nurse, his future wife Susie, established the world's second ECMO program at MCV. Imagine how a surgery resident not working at a major children's hospital could pull this off. Clearly, Dr. Crummell had strong leadership skills and a vision for the application of new technologies to improve the lives of children early in his career. Dr. Crummell presented his work in 1982 at this meeting. Following his completion of general surgery at Richmond, Tom did a pediatric surgery residency at the University of Pittsburgh under Dr. Mark Rowe. After completing this residency, he returned to MCV to work with Dr. Salzburg in the Division of Pediatric Surgery. Tom sought out a talented biochemist named Dr. Bob Diegelman to help in his investigations of wound healing. Dr. Crummell wanted to solve the clinical problem of lung injury in children with CDH causing pulmonary fibrosis, and Dr. Diegelman was an expert on tissue injury. While working with Dr. Diegelman, Dr. Crummell met Michael Harrison, my mentor as well. Dr. Harrison is also a past recipient of this award, and they met at an APSA meeting. Dr. Crummell was fascinated by fetal surgery and the research performed in the Harrison lab at UCSF. He arranged to do a fellowship unfunded with Dr. Harrison. So, with only a bike and a suitcase, Tom moved to San Francisco and learned the tricks of fetal surgery and how to develop a research program on fetal wound healing. This is where I first met Dr. Crummell. During his fellowship, I was the junior resident, as Dr. Bessner mentioned, in pediatric surgery. It seemed like I was always looking for Dr. Harrison because I had questions regarding patients. I would go to the lab, and there I found Tom Crummell. We started a conversation that led to my seeking out his advice on multiple occasions, during which Tom guided me through the patient care issues on my consults in pediatric surgery. This is the second time, by the way, that Tom was practicing medicine without a license in California. Tom returned to Richmond and worked further with Bob Diegelman and a leading wound healing surgeon scientist, Dr. Kel Cohen. Not surprisingly, Dr. Crummell was funded on the first try for an R29 and then transitioned successfully to an R01, which he held for over 20 years. Tom made significant breakthroughs in embryonic wound healing, and I show this article because it was one of the very first published on the topic. After 5 years at MCV, working with Dr. Salzburg, Tom moved to Hershey to be the chief of pediatric surgery under Dr. John Waldhausen, who was chair of surgery. Dr. Crummell was the only pediatric surgery at Hershey for the first 6 months. In typical Crummell fashion, when I asked him about being on call every night, he stated, "The sign-outs were a piece of cake, and I didn't miss any good cases." Tom continued his meteoric rise and became chair of surgery when Dr. Waldhausen retired only 5 years later. Tom was subsequently offered the position of chair of surgery at Stanford, which he accepted in 1998. Now let's talk about Dr. Crummell, the innovator. Tom was a visionary architect and a relentless recruiter. After his first visit to Stanford, he came to New York City the next week and took myself and my wife Melinda out to dinner at the Four Seasons restaurant. He said the opportunity was very exciting at Stanford, but he needed me to go with him. Just to paint the picture, Stanford was literally a revolving door of chairs and interim chairs over a 25-year period prior to Tom taking the job. Yet he had a simple goal: to make the Department of Surgery as good as the average of the 50 other departments at Stanford University. Tom incredibly recruited over 100 faculty, including myself, and changed the trajectory of the Department of Surgery over the 17 years he led it. In addition to being chair of surgery, Tom was also the surgeon-in-chief at Packard Children's Hospital. I simply do not know how Dr. Crummell was able to do 3 jobs for those 17 years. But there's more. At Stanford, Tom saw an opportunity in innovation and went for it. His ability to make the most of whatever he was working on or at is a trait that separates Dr. Crummell from everyone else I know. At Stanford, Tom partnered in with Paul Yock to co-lead the Biodesign program. Stanford's Biodesign program is the world leader in teaching the innovation process. It's simply the dominant brand. In addition to co-directing Biodesign, Tom also developed deep friendships with outstanding innovators like Dr. Tom Fogarty, shown here and here at an American surgical meeting. Stepping away from surgery, Tom is busier than ever. He is the chairman of the Fogarty Institute for Innovation, Biodesign and the Fogarty Institute have launched over 50 startups and have treated over 3.7 million patients today. Dr. Fogarty and his Institute for Innovation currently has 12 startup companies in residence and will grow to over 20 in the next 2 years. Dr. Crummell made the decision to impact the lives of children and adults through innovation. Rather than one patient at a time, he leveraged his technology and now has impacted millions of lives. Dr. Crummell has the astonishing goal to impact the lives of over 100 million patients through new technologies before he retires. And I would not bet against him. It is notable that such innovators as Bob Bartlett and Tom Starzl, who have impacted the lives of tens of thousands of children through new technology, have also received the LAD medal. And finally, Dr. Crummell, the person. I've talked about his incredible career. Tom Crumle is a pediatric surgeon, an architect of multiple departments of surgery, and a world-class innovator. But who is Dr. Tom Crummell, the person? He is a son, he's a brother, he's a husband, he's a father, and now a grandfather. Tom met his future wife, Susie, shown here, in the NICU when he was trying to place an IV into a very sick young patient. They have been married for 41 years, and you simply can't know Tom without knowing Susie. They have 3 children, Allie, Maggie, and Katie. Maggie is married with 2 children, and Katie is married with 1 child. Here is the Crummell family at Lake Tahoe after a great day of skiing. And here they are more recently in Los Angeles. This is a picture of the F2 generation. This is Margot, Katie's daughter, and it looks to me like she's going to follow in her grandfather's footsteps as she's already wearing scrubs. Bon vivant describes Tom and Susie Crummell, who enjoy life tremendously. They have traveled the world, and I'm always amazed to hear about their fun adventures. For example, here they are hiking on a glacier in New Zealand. In summary, he is richly deserving of this highly prestigious honor, and has been my privilege to work for him and introduce him. Here is your 2020 recipient of the William E. Ladd Medal from the American Academy of Pediatrics, Dr. Thomas M Crumble from Stanford.
Dr. Bessner, members and guests of the surgical section, colleagues and friends, I am deeply, deeply grateful for the honor of this year's William E. Ladd Medal Award. There are at least 100 others equally deserving of this honor, and I fully understand the role of chance and good fortune in the selection process. I do count many of the past Ladd recipients as role models, mentors, colleagues, and friends. The list is a literal who's who in our field. I'm more of a who's he kind of guy. When Dr. Bessner called to give me the award news, it flashed through my brain that I should demand a recount. Luckily, I thought the better of it, and here we are. So again, my profound thanks. In his wonderful introduction, Dr. Longacher very generously highlighted a few small successes and graciously omitted the many missteps, mistakes, and flat-out screw-ups that don't show up on a CV. Nonetheless, they form a uniquely important component of a career. It is so important that the young people in the audience understand that. Over a professional career of 40 years plus, spanning 5 institutions, I'm indebted to the staff, students, residents, fellows, and faculty, the Medical College of Wisconsin, the Medical College of Virginia, Children's in Pittsburgh, Penn State, and Stanford University. Those countless interactions and friendships have all made an impact. To my patients and their families, I am grateful for your trust, tolerance, teaching, and for the parents' demonstration of courage when faced with a threat to their children. There's one guy that stands out both personally and professionally, and that is Mike indicated, was a member of the surgical section. Arnie was an icon, a mentor, and a friend. I'm one of Arnold's 12 disciples who were inspired to a career in pediatric surgery. Salzburg and the 12 disciples. Arnie's laughing up there someplace. Mike told the story of ECMO, and it was a remarkable and seminal one. I will supplement briefly that when we watched these 2 beautiful 4-kilogram babies died, it was incredibly frustrating, and we felt impotent, and that's not exactly a surgeon's happy place. The chance intersection with Bob Bartlett and his generous offer to teach a young and not very bright PG2 resident in 1980 will never be forgotten. Bob introduced me to the intersection of surgical science and bioengineering, which formed a foundation and a passion for the rest of my career, and both those two patients survived. Bob indeed is a Ladd Medal recipient. When I came back, we had the unique experience of starting an ECMO program, and it arguably is an insurance nightmare when we had two dog lab technicians and my wife and myself as a PG3 resident as the team. As Arnie pointed out, when we reported those first 6 successes 38 years ago at the section, Bartlett proved ECMO could be done, Krummel proved anybody could do it. The AAP surgical section offers the Salzburg Award for mentorship, and there's a damn good reason for that. While there are many others, I would like to specifically acknowledge two inspirational big brothers, Mike Harrison and Jay Vacanti. Both of them created entirely new fields out of nothing, creating fields that had never been imagined before. I count them among my closest friends, and both are Ladd Medal recipients. John A. Waldhausen also had an impact worth commenting on. He recruited me as chief of pediatric surgery. Little did I know that he was quietly grooming me to succeed him as department chair. He taught me the art and craft of leading a department, and those were priceless lessons for the journey west to a troubled Department of Surgery in 1998. It's worth mentioning that John's son, John H.T. Waldhausen, has made his own mark in pediatric surgery and is currently APSA president. John A. Waldhausen always emphasized the need for a trusted colleague, a rock of Gibraltar for the inevitable academic battles and scrum fights. Dr. Mike Longacher has been that rock from day one at Stanford. I and Stanford University owe Mike a profound debt of gratitude. Thank you so much, my friend. Also at Stanford, Drs. Jim Mark and Norm Shumway provided counsel, shelter, laughs, golf, and endured my occasional primal scream. Over 22 years in Silicon Valley, I have been privileged to learn from 3 master physician innovators and inventors, Drs. Paul Yock, Rodney Perkins, and as Mike mentioned, Tom Fogarty. More than 40 million patients have been treated with the inventions of those 3 icons. That is leverage, and all of them epitomize the quest to develop new therapies and train a next generation of health tech innovators. On the personal side, my parents, Jim and Helen, taught me everything about what is important long before I went to school. They taught me that you don't need much to have a lot, and that scarcity and necessity drive innovation. I'm fortunate to have 2 terrific brothers and a terrific sister, and Mike, thank you for mentioning them. Finally, and most importantly, I am blessed with an awesome family, my cherished wife, Susie, an equal partner in all things on our winding road together, 3 treasured children, and now 2 wonderful sons-in-law, and joyfully 3 grandchildren. They all keep it real. They are my foundation and make everything worthwhile. Those family foundations are a daily reminder of both my blessings and my responsibilities to others in need. Dr. Ladd, when queried about his motivations towards the surgical care of children, wrote, "Children's was my first and most permanent love. I devoted myself exclusively to pediatric surgery and have never regretted it. I too have enduring joy in a pediatric surgical career and zero regrets." The Ladd Medal is truly icing on the cake. Again, my profound thanks to the surgical section, to Drs. Bessner and Longacher, and to all of you. Thank you so much.